and will be providing today's COVID-19 case update. Dr. Clayton will provide today's update, and then we will take your questions. I'll turn it over now to Dr. Clayton.
Good morning. As of today, we are reporting 58 new cases of COVID-19 in the state. This does include 11 new hospitalizations as well as 2 new deaths, one among a Minnehaha County resident and one among a Pennington County resident. We have 130 new individuals who have recovered from COVID-19 as well as 606 new negative tests that have been performed. In total, that brings our COVID-19 case count to 4,085. Of those, we have 1,125 active infections and 2,914 individuals who have recovered. We've had 327 hospitalizations and 46 deaths as part of those cases. And in total, we've seen 25,624 total negative tests performed. For our updates to the community impact map today, we have Beadle County being elevated to, I believe that's substantial transmission. The new cases by county include 6 in Beadle, 5 in Brown, 2 in Buffalo, 1 in Charles Mix, 1 in Fall River, 1 in Hughes, 4 in Lincoln, 2 in Lyman, 2 in Marshall, 15 in Minnehaha, 16 in Pennington, 1 in Roberts, and 2 in Turner. For the the new cases by age range, we have 9 in the 0 to 19 year age category, 12 in the 20 to 29 year age category, 10 in the 30 to 39 year age category, 10 in the 40 to 49 year age category, 5 in the 50 to 59 year age category, 8 in the 60 to 69 year age category, 3 in the 70 to 79 year age category, and 1 in the 80 and older category. For new cases by sex, we have 26 that are male and 32 that are female. For the deaths that have been reported, we have 2 that have been in Beadle County, 1 in Gerald, 1 in McCook, 40 in Minnehaha, and 2 in Pennington. For deaths by age range, we have 1 in the 30 to 39 year age category, 1 in the 40 to 49 year age category, 7 in the 50 to 59 year age category, 7 in the 60 to 69 year age category, 5 in the 70 to 79 year age category, and 25 in the 80 and over category. For deaths by sex, we've had 22 that are male and 24 that are female.
Thank you, Dr. Clayton. If you would go ahead and unmute your lines, we will take your questions.
Good morning, JP from KORN News Radio.
Go ahead, JP.
Thank you very much. Could you give us the latest numbers from the Dakota Provisions plant in Huron, the Demcoda plant in Aberdeen, and Smithfield in Sioux Falls?
So I do not have the breakdown for Dakota Provisions. Please go ahead and request that through our Joint Information Center. For Demcoda, we've had 124 cases. For Smithfield, we have remained at 853 cases and 245 close contacts that have themselves become cases. Specifically, those who have recovered, we have 80 individuals that have recovered that are Demcoda employees. 836 of those Smithfield cases have recovered, and 245 of the close contacts that became cases have all recovered.
Next question.
Thank you.
Yep.
Troy Van Duzen, KXLG Radio in Watertown.
Go ahead.
We're hearing some information that there could be a possible outbreak at the Big Stone cheese plant in northeast South Dakota. Do you have any information on that?
So we have identified cases in the cheese plant, and we're actively working with them to both review existing protocols around the employee screening upon arrival, general discussions of PPE and other precautions that are done within the plant, and discussions about testing as well.
Okay, thank you.
Next question.
Hi, Ray from Keloland News.
Go ahead, Ray.
Can you talk a little bit about how the process is going for testing at nursing homes?
Sure, Ray, this is Kim MALSAM-RYSDON. So we are working with all nursing homes in the state to do mass testing of their residents and staff over the course of the next 2 weeks. The process for that is that the nursing home has to determine logistically how they want to carry that out. Nursing homes have nursing staff on site that can actually do the specimen collection. The second thing that the nursing homes have to do is determine what laboratory they plan to use. If they do not have a laboratory in mind or have arrangements with a laboratory already, we have a out-of-state commercial laboratory that is available to them to actually conduct or to process the testing. So once those tests are collected and the lab has processed them, all positives and negatives will come to the state, and we will conduct case investigation and contact tracing as necessary for any positive cases that were to come from those lab results.
Next question. Oh, go ahead, Ray.
Can you talk a little bit about how this fits into the CMS announcement yesterday with suggestions about reopening nursing homes?
Yeah, I think we would see it as extremely consistent, and obviously the CMS guidance talks about ensuring that nursing home residents and staff have access to adequate testing and include the capacity to test all residents and the capacity to test all staff on a baseline basis. And so that's exactly why we are working with the nursing homes in our state to do this mass testing in the next couple of weeks.
Thank you.
Next question.
This is Morgan from the Rapid City Journal. Argus Leader.
We'll go first to Morgan and then to the Argus Leader.
About the death reported in Pennington County today, can you confirm if that's the Super 8 worker who died May 9th at all?
I cannot confirm that. We do not specifically talk about individual deaths that have occurred.
That's okay. I have a follow-up. Can you talk about how the deaths are reported? I mean, whether people are ever tested posthumously, and whether if people with pre-existing conditions or other illnesses get reported as maybe both like a COVID death and another cause of death?
So yeah, the idea of individuals and how they're reported. So we do wait for the death certificate as the kind of final verification that cases have died from COVID-19. We a lot of the times that is based on information on available testing or individuals who have been in close proximity to cases that help inform the medical examiner, the coroner's or medical provider's decision on how COVID-19 played into the death. Specifically, we have, and CDC guidance does allow for the collection of posthumous samples for testing, and so that I know has been done in the past. And we see it as a continuation to help identify when we do have COVID-19 as a contributing cause to the death. In total, that individuals can have other comorbid conditions that are listed on the death certificate, but we look to see whether COVID-19 is located anywhere on the death certificate, either as a direct contributory cause or underlying cause toward the individual's death.
And that test is taken the same way as like the nasopharyngeal swab?
That is correct. There are other specimens that can be taken from a swab of the lung as one example, but for the most part, individuals with COVID-19, there's a perspective to not specifically conduct autopsies that are not necessary for individuals with COVID-19 due to risk of transmission through the autopsy process. So the majority of specimens that have been tested in the state that I'm aware of, at least, have been using the nasopharyngeal swab directly into the nares, as most individuals in the state are tested.
Thank you.
Yep.
I believe Lisa from the Argus was next.
Yep. Just wondering, in the Beadle County cases, just wondering if there's a hot spot and if you can confirm that there are cases connected to Dakota provisions.
We have a number of cases that we've identified, again, with the Demkota beef plant, and we've reported out on those. There's no other kind of quote-unquote hot spot that we've identified within the Brown County area. I can... Oh, sorry.
Beadle.
Sorry, Beadle. My apologies. Yes, the Dakota provisions, that we do have cases associated with Dakota provisions, and again, we are working with that business specifically. We try to avoid talking about number of cases within an individual business unless there's a need for a public notice or larger sort of risk to the public, and so I won't provide a specific number in that circumstance, but just know that we are, again, working with the management at Dakota Provisions to help identify and understand their current processes around screening of individuals upon arrival at work, the personal protective equipment and other precautions that they have in place for the workforce to try and decrease any risk of the transmission due to COVID-19, and again, a focus on what can be done around testing to identify any potential cases.
Next question.
Ray from Kelland again.
Go ahead, Ray.
Yeah, with the testing in nursing homes, basically that's a snapshot in time for the particular day you're testing. What can that be used for? Is that just looking to establish some sort of baseline of where things are at? Because they're already doing temp checks, a lot of times before shift start and after shift starts, and multiple times of residents.
Right. So, Ray, this is Kim MALSAM-RYSDON again. The idea behind the mass testing is to ensure that there aren't asymptomatic individuals who are in fact positive, who could be coming into contact with a very vulnerable population. After mass testing happens, then we would move into a sentinel testing situation, and that's where we would have a random sample of people tested on a weekly basis to try to, again, determine if we've got asymptomatic people that are coming into contact with folks in nursing homes.
And just a quick follow-up, we've been hearing a lot about percentage positive of testing. Mass testing of nursing homes can kind of skew those test results, either positive or negative. How does the DOH going to share those results? Are you going to say, quantify it? Go ahead.
So the results will be part of our daily reporting out, just like any other results would be. I do think you bring up a good point about the percent of positives to the number tested and kind of how useful that is as a measure, because it really does depend on how much testing and how you're really targeting, testing to whom. And so I think it's more nuanced than just looking at the straight number and making flat conclusions from that.
All right, we have time for one more question.
This is Jack Cottle with KEVN and KOTA.
We'll go to Jack.
The numbers in Pennington County had stayed relatively low for a long time and now are taking a big spike upward. How do you see the trend here in Pennington County specifically, and have you identified any kind of hot spots of any magnitude here?
Again, I think the perspective that we've had is as we have individuals who are having more contact as they return to work, return to the other business settings that they're customers of. I think you're going to see, additional cases within a lot of the communities. So the focus that we have is on just making sure that individuals have the proper information so they can make appropriate precautions and take those precautions, and that we have identified no specific clusters within the Pennington County area that are contributing to the overall increase. It's kind of a generalized community increase that we're seeing.
All right, thank you all for joining us this morning.